Well, welcome back, everyone. You know, October is Breast Cancer Awareness Month, and Dr. Darlene Weyer, director of the Lima Memorial Women's Health Center, is here to talk about screenings. Why is it important to have an annual mammogram screening? We're going to find out. So, Dr. Weyer, welcome.
Thank you, Chris. Thank you for having me.
Yeah, so why is it important?
It's important to have a screening mammogram because it is the gold standard for the detection of breast cancer in a patient who is completely asymptomatic. It's an imaging modality that we use that uses low radiation to see whether there's any breast cancer within the tissue. The sooner we're able to pick up a breast cancer, the better the patient is able to be treated, the less invasive her treatment. So we want a patient to come in every single year to have a mammogram starting at the age of 40.
Yeah, so who is a candidate or recommended to start receiving mammograms? And also, what can they expect when they do come in for their screening?
We start annual screening mammograms at the age of 40, and a patient should have a mammogram every single year without ever skipping. If a patient has a first-degree relative who has been diagnosed with breast cancer, we start 10 years prior to the time of diagnosis. So let's say that you have a mother who is diagnosed with breast cancer at the age of 42. We would then start your mammogram at the age of 32, and we would do one every single year. It's a comfortable exam. There's no pain. It's a 15-minute exam. We typically take 2 pictures of each breast, and then usually within a few days, you'll have the results.
Wow, okay, that's good. So between yearly mammograms, what can a person do to help protect themselves against breast cancer?
So after she has her mammogram, what she can do for the next year until her next mammogram is she can do monthly self-breast exams to be sure that there are no changes in the breast, because typically it's the woman that sees the changes first or notices the lump first. So if she notices any changes, it's important for her to bring it to her referring physician's attention so we can get her in to be sure that there's not a new cancer that's starting to develop. She can eat healthy, exercise, stress reduction, get plenty of rest, don't smoke, limited alcohol. Those are all things that can decrease her risk of developing breast cancer.
All right, so if a patient would like to schedule a mammogram, how can they get in contact with you?
They can call our center at 419-998-4497, and they can get their annual mammogram scheduled.
All right, fantastic. Well, Darlene, thank you so much for joining us today. I really do appreciate it.
Thank you, Chris. Thank you for having me.
Well, don't go away because we have more when we return.